Why do you start your career in health sector and why in Bangladesh? Why you choose to be a businessman rather than a 9 to 5 secure job?
There was no reason not to select healthcare as a career. And these MNCs, large organizations, they have a very formal, very researched, very fine-tuned processes. Bangladesh economy is growing. It's growing very fast.
Though you have already touched up a little bit on your introduction, but I want to ask you again the same question, that why do you start your career in health sector and why in Bangladesh?
Okay, I will come to Bangladesh in the second part. But the first part, if I answer very honestly, I would say it was not a very conscious decision, to be very honest. Okay, so after completing my MBA, there was job interview. So I just appeared in the interview, I got selected, and I chose an offer which was actually giving me more money. And healthcare as an industry was even doing good, so there was no reason not to select healthcare as a career option for industry. So that's how I started in healthcare, and then I started enjoying doing what I was doing, and especially during my tenure with UpToDate, I would say I spent almost 7 years with the work student. There was a feeling of satisfaction, because I don't know about whether you know this product or not. UpToDate is a clinical decision support tool. So it supports the clinician, doctor, to make more effective clinical decisions. Coming to your question about why I chose Bangladesh, throughout my career I worked with all large MNCs, and these MNCs, large organizations, they have a very formal, very researched, very fine-tuned processes. So you work within the process, and many times even when you like to make some changes, you don't have a room to that. You do not have a flexibility to do that, because company has already set a process. So I wanted to work with some kind of mid-sized company where I could actually use my experience in terms of setting up the processes or defining the processes, and so that was my kind of idea. So when I got this opportunity of working this hospital network in Bangladesh, I took this as an opportunity, and I helped them setting up an online platform which would assist their patients, and also that would assist the hospital building their online business. That was also quite a satisfying experience.
Compare from your viewpoint about the healthcare industry on India and Bangladesh.
See, overall, any industry is evolving. First, the government has done it, that is actually giving results. That is good. I know that many hospitals now are offering, services for critical conditions, complex surgeries also being performed. That is good.
How you find the working scope of foreign staffs here in Bangladesh?
See, there is a scope. Definitely there is a scope, and that's why I was here, to be honest. Bangladesh economy is growing. It's growing very fast, and that is also resulting in the improvement in the healthcare infrastructure, and like healthcare, many other industries. Because of that, new scopes are coming, which is allowing the people to hire talent from outside.
Why you choose to be a businessman rather than a 9 to 5 secure job?
Well, it's very interesting, and I would first like to comment on that security thing.
People used to think like this.
I would say even I used to think like that, because you get salary at the end of the month, so there is a security in that. But talking about security, there is no security on anything. You do not perform in your job and you lose the job, right? Correct. So there is no security. Likewise, in business, you do not do good and you lose everything. So the security per se is nowhere. We, as a professional, whether we are working for a company or working for yourself in your own company, you have to be professional. You have to, you need to understand that there is no security. Things will change. Tomorrow will be different than today, and therefore you should always be willing to evolve, learn new things, try new skill set. So there's no security. But to your question, why I started, I was thinking on starting something on my own. I actually was thinking of, since I spent in healthcare, so I thought I will do something in healthcare. And my idea was that if I could use the technology, which would actually, and use that in healthcare, there is definitely a scope, there is a gap to connect the patient with the provider, which is accessible. And then comes affordability. Okay. Like for example, if you want to go to India, I'm just giving you an example. You want to go to India, obviously you will have a strict budget. Now, whether you go to hospital A or you go to hospital B is a difficult question, and this decision is also based on the funds that you have, that you are willing to spend. So the first thing is the accessibility. You need to know which hospital is giving the services. The second thing is the affordability. You need to understand which hospital would be suitable for me to work within the funds that you are willing to spend. So I thought to work on this accessibility and affordability area. So we have built a platform which is a very dynamic platform, online platform, which is helping our patients to find and connect the right provider. And then our services chips in there, and we try to help our patients in providing the logistics. So that is the idea which actually came, and that's the idea that I'm actually.
That's a very good idea, I must say. Do you think you need Bangladeshi talent for your Indian company? Is my recommendation necessary for the Bangladeshi candidate? What are the challenges to start a startup? Why most of the startup fails? Besides Google Ads and Facebook boosting, what are the marketing hacks, digital marketing hacks you will recommend?
Having the fancy ideas is not the only thing, but a useful idea is important. But our website also has a Bangla version. Will actually come with a scaler. If you do not have a process, you cannot scale. There is no such hack, I think. Oh yes, that's the one thing I like the most.
Okay.